Today I'm talking about recovery after your liposuction procedure with me, Dr. Costa. Just know that these are my personal instructions for my patients. Obviously, if you've seen another doctor, please follow their instructions that they give you. This guide will give you a lot of information and help you if you're considering this procedure, what the recovery is like, and what we instruct for our patients. Let's first talk about activity after your procedure. It's very, very important that the day of your procedure, you go home, get some rest, but I want you up walking every 3 to 4 hours, just around your living room, nothing crazy. What this does is it helps get your blood circulating and it helps get some of the drainage out. The reason that's important is we don't want you to get a deep venous thrombosis or a blood clot, because that can be a very, very serious complication. The best way to prevent that is to get up and move around and walk. But you're not gonna do anything too strenuous, nothing to really get your heart rate up. For the first 2 to 3 weeks, I'm gonna just have you kind of chill, like I said, up walking. At 3 weeks, I allow you to start light activity back. You can start doing some stationary bike, start getting your heart rate up to about 100. I release you to full activity to do whatever you want at 6 weeks. The next thing we're gonna talk about is your compression garments and what to wear after surgery. Everyone has a different take on this in terms of what garments you should wear, how long to wear them. I like for my patients to be in compression after surgery for approximately 6 weeks. And at the 6 weeks mark, we can evaluate if we need to continue that any further, but usually 6 weeks is sufficient for everyone. We give you your first garment. My instructions are to wear that garment 24 hours a day. You can take off the garment to wash it for an hour or two or to take a shower. That's fine, but really you should try to stay constantly in some compression. After a liposuction procedure, part of the procedure is we inject a lot of fluid into the tissue underneath the skin that facilitates with removing the fat. It also facilitates to decrease the chance for bleeding. After your procedure, that fluid tends to leak out over the first 24 hours usually. It can be very, very overwhelming because it will look like red fruit punch. People will think they're like bleeding or something horrible, but it's just all that fluid that we inject during the procedure, which is a very necessary part of the procedure. I recommend everybody to buy puppy pads, put them all over your house, put them over your recliner, your couch, your bed. Just be prepared for like a lot of drainage. In terms of cleaning yourself afterwards, for the first 24 hours, I like you just to use like a wet washcloth, and the next day after your liposuction procedure, you can take a shower and clean yourself. But no submersion underwater like in a bathtub. In terms of taking a bath, if it's just a liposuction procedure, usually at 2 to 3 weeks, as long as all of your incisions are sealed and closed. Getting comfortable after surgery. Number one, waterproof the area that you're gonna be recovering in, because like I said, you're gonna have a lot of that fruit punch colored fluid coming out of the small little incisions, usually for the first 24 to 48 hours. So having, like I said, puppy pads around to soak up any of that drainage is gonna be, I think, very, very important. Sleeping after liposuction, so I want you to sleep in your garment. Whatever you can do to get comfortable is fine. If that means you gotta use a lot of pillows and position yourself in a certain way, that's good. If we did a fat transfer procedure, like fat transfer to the butt, my preference is that you try to sleep on your stomach or a little bit on your side with some pillows to alleviate that pressure off the buttock. Although I want you to be comfortable and sleep like any way you want to, it's very important that you don't really use any heating pads to the areas that we've treated. You will have some numbness on your skin, and heating pads can cause some serious burns and complications. So it's very important that you don't use those. Same kind of goes with ice. If your skin is numb, you can't tell if you're getting a burn from the ice. So I want you to kind of limit that and just stay in your garments. The number one most important thing when getting any procedure, whether it's liposuction or anything else, is to stay away from nicotine smoke. Don't start smoking, don't smoke after your surgery, because that is the number one thing that can cause you to have a bad wound healing complication or get an infection. Most of our patients are off of any sort of prescription pain medication within the first 24 to 48 hours. We do a recovery protocol where we actually give you some pain medication that you start the night before surgery to help treat multiple different pathways for pain receptors. to help patients with that recovery, and that's something I do for all of my surgeries. That in itself does help limit how much pain medication usually that you need to be on. I don't really want you on pain medication because, like I said, I want you up walking. I don't want you sleepy or drowsy. I want you up moving around so that way you don't get any other sorts of complications. Typically after the first 24 or 48 hours, you are good with just over-the-counter pain medication. I like my patients to be on 600 milligrams of ibuprofen every 6 hours with 500 milligrams of acetaminophen. If you are taking any narcotic pain medication, I always recommend that patients take a stool softener starting the day of surgery. That will just help to keep you regular so that you don't have any issues. No dietary restrictions at all after surgery. If you had general anesthesia, it's sometimes good to start with just some liquids and make sure that you don't feel nauseous because you can have some nausea from the anesthesia. If it was done locally in our office, no restrictions. If anything, I'm usually telling my patients, even if you're not super hungry, like you gotta eat. Usually after surgery, patients are like not hungry, they don't want to eat, or they're eating very, very little. I want to encourage you to increase your protein intake, get as much nutritious food as you can, both before surgery and after surgery, so that way you heal well. When should you be concerned or call the office for any issues after your procedure? Complications after liposuction are very, very rare. Most patients do absolutely wonderful. Having a low-grade temperature for the first week after your surgery is actually a normal thing. But any temperature that's over 101, I always recommend calling the office, and if the office isn't available, go to the emergency room. If you have any increased redness, pain, a fever that develops after surgery that wasn't there the day before in the first week or two, those are warning signs, and we want you to call the office immediately so we can get you in and assess you. Any rapid increased swelling in any of the areas that we treated, say like the next day or even within the next week or two after surgery, that's another thing to just call our office. The big thing is if you experience anything that you're really not sure about, that we haven't reviewed with you at the time of your pre-op appointment, just call our office. Our staff is here. That's what they're here for, is to answer any questions that you have. Thank you for tuning into this video. We post videos all the time about recovery after surgeries and your questions about surgery. If you have any questions about this procedure or any other procedures, please leave it in the comments below. Please be sure to like this video. It helps us out a ton. Thanks, and we'll catch you next time.